Like, I don't address them in the right respectful way, so you really push it off those guys.
Yeah. Yeah, they are really big on the sir, ma'am, Mr. or Mrs.
I find they also feel like they know more than you.
They
Yeah.
probably do though. They're really old.
Well, I mean, like, no, I just mean like in the sense, like, if, for example, when I get like older patients and they have to go for a CAT scan, and then they argue with you about what they're having a scan over because they don't agree with like the doctor's opinion on what might be going on with that.
Yeah, I think we've come full circle to they are very opinionated, right? And again, sometimes they absolutely know what they're talking about because they've been around forever. And sometimes they just don't understand, right? So this is something that you're going to have to be very familiar with. It is likely different culture, okay? Also, notice that there's an aging workforce for the same reason. Okay, you have a whole bunch of baby boomers that, for whatever reason, did not retire. Guess what? You're going to be working with them. In fact, you're probably going to be working for them because they've been there for the last 45 years. Okay? Again, they're going to expect you to address them with respect and with titles. Okay? That is just how they did it back then. They consider it extremely weak. Kind of like if you are addressing somebody from the Ukraine and you don't use their title, they're going to get extremely offended. Okay? It's just like a different culture. Okay? Because it was a different world where they grew up. Even if it was here. Okay? Questions, comments, more? All right, so I think that's about it from your PowerPoint. I think I moved it recently after I loaded yours. But how would you feel if this were your family member? Scared? Helpless? Sad, nervous, uncomfortable? What? Uncomfortable?
Loss of control.
Yeah, lack of control, right? That's a lot of machines. And to walk in and see somebody that you dearly love hooked up to all of this, that can be pretty devastating to people, right? Again, this is part of your job as an advocate. It's not going to bother you after the next, you're doing it 5 years or so. You're not going to notice all of the sounds and beeps and the plugs and the wires and, a person looks like they're come right out of some kind of science fiction movie. In fact, another 5 years it might look like that, literally. That scares people to death when they walk in and that's what they see. Oh, they start screaming and crying because all of that stuff plugged into somebody means that somebody's pretty messed up, right? Which may or may not be true. So, again, just keep that in mind. There are some ethical concerns, let's say. Once you are practicing a little while, and sometimes you get a little jaded, depending on what kind of practice you're in. You all kind of get a dark sense of humor. That's fine. Just don't let the patient catch you with your dark sense of humor. That does not go over well. Okay? So, I think we already did this, didn't we? Did we already talk about this? Yeah. I mean, we didn't see the slide, but we kind of talked about it, right? How would you describe the ICU, the sights, the sounds? Yeah? Smells. Again, after a little while, you're going to get used to this sort of thing. It's not going to be as devastating to you. But when somebody walks in an ICU, who is a family member especially, it can be overwhelming. People are really hurt if they're in an ICU, right? Or critical care. Like one of you guys said, there's that palpable sense of red, right? Sometimes, okay? Again, part of your charge is to try to comfort people, you know, because that's one of those things where you can't necessarily, I don't know, maybe they can always explain why when people are in better moods, when they're laughing, why they heal faster, okay? I'm sure there's some kind of, you know, endorphins or something like that that has something to do with it, but sometimes you gotta lighten the mood, but you don't wanna get appropriately light in the mood. And that can be a fine line depending on who you're talking to and who your patients and family are. Okay. Questions, comments on that? All right. So again, like this, what kind of what we talking about? You're gonna have a lot of stress and anxiety. And did I mention that, by the way, the reason this PowerPoint is mostly critical care stuff is because that's really where you see it. That's where you see ethical issues, okay? Somebody comes with a cold and you're in a minute clinic or something, it's not really a lot of ethics involved in that, right? Ethics come in when you're in a critical care situation more often than not. Okay? And of course, everybody's already stressed out, has a lot of anxiety. There's sensory overload with all the lights and the noise and the loss of privacy. People coming and going all the time. And speaking of that, that's another thing where I'm not sure if anybody is going to tell you along the line or not, so I'll just kind of throw it out there. When somebody gets hurt or sick or they are critically ill in a hospital, okay, what they need is whatever medicine, surgical procedure, total cause that have to be done to help them physically feel better, and then they need a lot of rest, okay? What tends to happen is when somebody gets hurt really badly, everybody they know shows up at the hospital, and they're all crowding in the room. And at what point is it hurting the patient more than helping, right? Because some people, hopefully the vast majority of people, are there to show support and to show that they care about them and give them encouragement and that sort of thing. But you are going to run into people that are there because of that, right? It's all about them. And they're going to be taking pictures of them with the body, not the body, hopefully. with the, you know, with the somebody, yeah. And, you know, posting on Facebook, oh, this is so horrible for me, and it's so hard for me, and then they get 80 of their friends saying, oh, it's so horrible for you, blah, blah, blah. Right? It's about them, it's not about the patient. Here's a question for you. If you get in a situation where you have a whole bunch of people in the room, and you can see that it's kind of stressing the patient out, and the patient's not getting enough sleep, and it's visiting hours, what can you do about it as a nurse?
Ask patients to leave.
Okay, you're still a patient's advocate. What did you say?
You ask the family to leave that you need to do a medical procedure.
Okay, you can always do that. Not supposed to really lie necessarily straight out, but sometimes, yeah, the bending of the truth works. Yeah.
Situations like that happen, they put a note on the door that says "see nurse" before entering the room, and in that case, like the family has to go to the nurse and get permission to enter the room if the patient
hours? Sure as I can, and I've seen nurses do it, they will walk in there, all of you out right now. They'll be about that polite. If not more polite, yeah. So yeah, that's, doctors usually don't kick people out of rooms. They're not in there long enough to notice. Nurses, absolutely, you'll be the one to notice. If this patient needs some privacy, needs some rest, needs to just, not have everybody there. They can go ahead and comfort each other, because really, that's what's happening. Unless you happen to be a medical professional, if you show up at a hospital, it's for each other. And especially if the person's like unconscious, so do that in the waiting room. That's no point in taking up the,
When I worked at a birth center, we had the saying that with every visitor that came in while mom was laboring, that it would add an extra hour. And this family, it was like 15 people in this room while this mom was laboring, and she had like a 52-hour labor.
What?
Yeah, it was crazy.
That's an interesting saying. And an extra hour every 20 minutes.
Yeah.
I've never heard that before. Interesting. Either way, though, you definitely get into cases where it's not the patient's best interest to have that many visitors. Yes. If it's an ICU, you can absolutely make whatever rule you want, and frequently they do. It'll be like we can only have one person in the room at a time.
My brother has like some kind of weird viral infection. They never actually figured out what it was. But when they had him in isolation, there was only allowed to be like 2 people in the room at a time.
Surprised I let 2 people in the room.
We had to be like